Hello everyone, and welcome to Fiona and Fleur's review so far of the GOLD Perinatal 2014 conference. I am Fiona Lang-Sharpe, IBCLC, and I am one of the MCs and Public Relations Coordinator at GOLD Perinatal. Welcome everybody, and Fleur, why don't you go ahead and introduce yourself?
Hi everyone, welcome. I'm Fleur Bickford, RN and IBCLC, and also Program Chair and our other MC for GOLD Perinatal. Welcome.
Yeah, we just wanted to give you a little bit of feedback on how we're doing, and we were so ecstatic to have such great presentations that we just wanted to take a pause and chat a little bit about how things are going on our end. And I thought Fleur and I could chat about what we thought about some of the presentations and the impact that we're seeing so far with the conference. So let's start at the top with Helen Ball. She's been doing an incredible job with her sleep ecology and, of course, her website, which is isisonline.org. And her presentation, well, it was phenomenal because we had many people register for it and sign up, as you know, Fleur, and I know that it caused a lot of interaction while she was presenting. Both you and I got to present on one each, which was fantastic, and I think she did an equally great job both times with Q&As as well. So that was great. So tell me, Fleur, what are some of the things that you thought were practical that you learned from her, or perhaps that you saw our delegates engaging with?
I think it was just really wonderful to see all of the research regarding infant sleep. I mean, a lot of us who work with babies, you know, we know instinctively what is normal and what isn't normal, and we know that, you know, babies sleep better when they're with mom and all of that. But obviously for, you know, a lot of healthcare providers, there's a lot of concern about babies sleeping in bed with mom, and it's just really wonderful to see, you know, in black and white what the research is telling us. And, you know, interesting to see that what the research is telling us is that, you know, yeah, the best place for baby to be is with mom. So really interesting to see that. And just, I think it's great for healthcare providers to have that research and to be able to take that research back to their places of work.
Yeah, I couldn't agree more. I think one of the things I love about Helen is that for me as a practitioner is that she's a go-to person for me now on sleep. And, you know, I can send my families there safely. I can send my colleagues there. It's up to date. And I think that's the key thing. I've been listening to her for a few years. And every time I think, oh, she's speaking at this conference, you know, oh, should I listen to her? Because I've heard it before. But yet every time I listen to her, she's got all this new research again. And so she continues to do a phenomenal job on the cutting edge. And I know I asked her about some of the research that's going on around the world and in different countries, and she's really excited because it really is expanding into different countries. So I was excited to hear that from her for sure. And I know that she's looking forward to seeing some of the research being developed around the world. So that was really, you know, not only interesting to hear, but exciting in terms of, you know, some of the struggles that, you know, you and I, Fleur, have with our clients and getting conflict of information. It'll be great when that, you know, that information continues to get out there into the public for sure. So tell me, who do you want to talk about now, Fleur?
Well, one of the speakers that I had the privilege of listening to while she was recording was Dr. Amy Gilliland. I got to hear both of her presentations that she did. So the first one that she did was Let's Stop Trying to Turn Men into Women, Meeting the Real Needs of Pregnant and Laboring Fathers. And I found that presentation really interesting because it was the research that she was talking about. It wasn't quite what you would expect in terms of, you know, how fathers feel about participating in labor and delivery and what their needs are, you know, compared to what we might think their needs are. So it was really interesting to hear about the fact that fathers, there may be some fathers who don't necessarily want to be in the delivery room, or they do want to be there, but they're uncomfortable perhaps because they, you know, they don't have a lot of control and they don't know what they should be doing and they don't know how to help. And of course, I think we all know that men really struggle in that kind of situation. They're problem solvers. They want to be able to fix it when their wife is in pain. And so being in the delivery room can be quite a scary experience for them sometimes, where they don't know what to do and they don't know how to help. And it's something we have to be really aware of. So I found that really interesting.
Well, I was talking about Edwin von Tullinger, and he was one of my favorite speakers today. He is a sociologist and spoke about the social and medical models of childbirth. And I really enjoyed listening to him. He really expressed really well how these models are entangled, how a mother would go from perhaps one element of the social model, perhaps with midwifery, right through to the medical model of perhaps being with an obstetrician. So for me, it was very interesting listening to him from that point of view, being a sociologist and not per se being embedded in the medical field and working there and looking at from the outside in. And although he's married to a midwife, so he says, he's slightly biased, but he really, he spent his life, looking at this and seeing the effects of the different models. And of course, there's a place for both, but how they can swing depending on where the mother comes from or where perhaps the physician or midwife even comes from as well can have that impact. So he was definitely, if you're just hearing this now, he's definitely a worthwhile listen to. And he's up on the website. His recording is there now. Which other one would you like to chat about, Fleur?
Um, Another one that, well, I enjoyed all of the presentations, of course, but another one that was really interesting to me was Penny Simpkins' presentation. So she was looking at from fetus to adult, how epigenetics and pregnancy events influence one's lifespan. So epigenetics is, of course, quite the hot topic these days. And so she was really looking at how events during pregnancy, so while the fetus is still in utero, how things that are happening to the mom during pregnancy, what impact that can have on the fetus, and how that impacts the person over the course of their lifespan. And she was talking about how stress that happens during pregnancy really can have an impact on the fetus, and it causes genetic changes. So that stressful environment can cause genetic changes, will cause different genes to be expressed in the baby, and those epigenetic changes are passed on generation to generation. So really, really interesting to look at and to think about how what is happening during pregnancy might have an impact for generations to come. And we talked as well, Penny was talking about how it may be possible to minimize the impact of any stress that the baby is under in utero, and perhaps even reverse some of those epigenetic changes by providing a really positive environment immediately postpartum, so with lots of skin to skin and unhurried breastfeeding. So definitely a really interesting new area of research, and something I think for all of us to be very aware of.
Oh, absolutely. I think that, again, what I love about Penny is that she's been around for a very long time, well respected in the industry, and always coming up with great topics. Like she's on the cutting edge. It's just phenomenal. And I just, again, somebody I could listen to for a very long time. Someone that I hadn't heard speak before, but I've seen plenty of her material because she's published everywhere, was Diane Wiesinger. And I love this. I know, Fleur, that you had heard it before, or a version of it, but it was great. She did a great job She has great slides, very engaging, and she just calls it the way it is. You know, there's no two words about it. Diane doesn't mess with her words. She just tells you the way it is. So this topic was about what would mammals do and the comparison, of course, with humans, and you know how we've really sort of taken away from birth and those aspects of mothering and those types of things. So it was great. I really enjoyed what she said, and it was profound enough that, you know, wasn't a light, you know, I mean, it was really profound and detailed. And I think it's not anything that we don't know. It was just that, you know, she just brings it full front, like she puts it right in your face, and you're like, crap, I need to start talking about this more. You know, I need to be able to vocalize this to my clients and, you know, and people in the industry. People need to keep talking about this. So it's, you know, it's the basic foundation of what we always need to be looking at, so that we're not taking away from mothers, so that we're feeding into them, and so that the mothers essentially are feeding into their babies, and you know, and then they can, of course, be, you know, then connected in such a, you know, beautiful manner. Again, it's just, you know, again, this whole thought of, you know, women rejecting their babies and not wanting to be close to them, not understanding them, or you know, not being able to understand the behaviors. And you know, and it is so important that we're able to, you know, give this to women and nurture them through this experience. So I very much appreciated this talk in so many ways, and it's a very full. She's got lots of slides, so you'll definitely enjoy that for sure, for sure. Okay, what about one more for now, Fleur?
Sure. So another one, it was a presentation from today, actually. So Dr. Martin Ward-Platt was
Okay.
speaking to us about new directions in blood glucose management. And one of the things that I love about Dr. Martin Ward-Platt is he's such a wonderful speaker to listen to, and he is really good at taking some very complex you know, medical type stuff and simplifying it and making it really easy to understand. And I really loved his talk today because he's talking about the fact that we really don't need to be putting so many babies through repetitive glucose testing because of the fact that blood glucose is not the only fuel source available to newborns. And I think that that is something that the knowledge has been there for a while, but it's been very, very slow for that to make its way into hospitals. And a lot of hospitals are still doing that routine blood glucose check, even on babies that are asymptomatic. So Dr. Martin Ward-Platt is really passionate about wanting to stop that unnecessary testing. And, you know, he says too, if the babies are asymptomatic and they're not high risk, then leave them alone. And I love that because, you know, every time we, you know, prick a baby's heel or we take that baby away from the mother to take them for blood glucose testing, you know, we're placing stress on the baby and often unnecessarily. So really, really interesting to hear about the fact that, you know, babies have other sources of fuel besides glucose. So even if the glucose level is low, that by itself doesn't give us the full picture because the baby also has other fuel sources such as lactate and ketones. So sometimes even if the blood glucose reading is low, if that baby is asymptomatic, they're likely fine and they're likely using other fuel sources that are going to protect their brain while the glucose levels are low. So really, really interesting stuff. And again, you know, really current research and really well presented. So I really loved his presentation today.
Well, I'm looking forward to hearing his presentation because it's something, again, that directs, you know, my practice directly. And so that will be something, that will be one of my go-tos as soon as I get a chance to have a look. I quickly just wanted to say that one of my presenters today, again, you have to stop in to listen to her because she really was very lovely to work with, I have to say. So Anna Polana Mushek, and she goes by the name Polana, was just lovely. She did a presentation today. I'm just going to find her picture here. There she is. I'll just pull it up so you guys can see it. So her topic today was mood disorders and the mother-infant relationship. And she talked about postpartum depression, psychosis, baby blues, all of them, and how babies and mothers are impacted throughout this whole process, the diagnosis and the treatment and all those types of things. So really worthwhile a listen. Really enjoyed it. She was, like I said, lovely, lovely presenter, and she also has beautiful artwork that her father did for her. And her father started doing this artwork when she actually started studying. She's from Slovenia, and she was one of the first midwives there. So she's done a tremendous amount of work in Slovenia. So you must definitely drop in and listen to Polana. So I think that's it for now. I think we should, it's probably time for both of us to go home. It's been a long day, I know, for both of us again. But we'll be back with some more chit chat, and we'll talk about our speakers and what's been happening at GOLD. And I just want to thank you, Fleur. I know you've been working really hard and getting all those presentations out. So thank you for that. And for all of our delegates listening in, I'd just like to say thanks again for being with us. And you've been listening to Fleur and Fiona chatting about the GOLD Perinatal Conference for 2014. Thanks, everyone, and have a great rest of your day.